So Sheila, Anjali's brought up the point about lifestyle management, and you've kind of now you are a qualified and certified lifestyle physician. What because anything goes these days under lifestyle, right? So what does lifestyle management really mean?
Yeah.
And what's your advice to people specifically around PCOS, but in general on lifestyle?
Yeah. So when we talk about lifestyle medicine, um, yes, you're right. Anything, I mean, this term lifestyle is just very, very popular nowadays, and it's, everybody's using it quite fluent, quite freely. In lifestyle medicine, what we do is we use evidence-based protocols, advice for patients for chronic diseases like this, like PCOS, like diabetes, hypertension, etc. But whatever is prescribed and advised has to be evidence-based. So it's not just, some superfood that is, will help you lose weight, or this particular diet that will help you drop 10 kilos in 10 days. It has to be evidence-based, preferably randomized controlled trials and so on. So when you talk about lifestyle, we normally address 6 pillars of lifestyle, which is food, nutrition, exercise, sleep, stress, social connectedness, and addictions. So these are the 6 main pillars. And every one of these pillars have a role to play in most of the chronic diseases.
Mm.
So one may play a more important role for some people, like diet may be the thing that's really off the charts for somebody. For somebody else, it may be exercise. For somebody else, it may be stress, and then all the spin-offs of stress. Sleep has been found to be extremely important, even for women with PCOS who have problems with sleeping, etc. So all of this needs to be addressed. It's not a one particular rule alone. It has to be quite extensive. So the what we call as motivational interviewing that we do, it explores every aspect of the woman's life, sometimes going back to childhood, sometimes going back to trauma, sometimes going back to, you really need to explore it, and then come to an understanding of, for instance, we do know that weight gain is associated with PCOS. So which comes first, the
Right.
PCOS or the weight, right? So either way, the weight has to be addressed. And then you have to think about why the weight is, there in the first place. No doubt PCOS prevents, or rather, women with PCOS find it far harder to lose the weight. They have very poor exercise tolerance, for instance. They get tired quite easily and all of that. But still, we need to address other aspects, because it's not just the food alone. It could be stress eating, it could be something, that comes back from her past. So a lot of history taking and counseling and talking and hand holding, for the patient. It doesn't happen overnight, doesn't happen with one consult. So anyway, to bring it all together, it has to be a multi-pronged approach. And there has to be what is called a therapeutic alliance with patient and doctor. It's not just a prescription that you write and slip across the table. It has to be, because it's not a disease, it's not a problem that is solved overnight. It's a long term.
Right.
The table. It has to be, because it's not a disease, it's not a problem that is solved overnight. It's a long term
Right.
thing.
Right.
Hmm.
And Dr. Usha, Anjali talked of, PCOS being different at different stages of life. Can you kind of talk us through that a little bit, and how does that affect women?
So we are aware of this irregular periods, which means it has to be post puberty, right?
Mm.
Just to bring up two things. Babies who are born low birth weight, meaning small for gestational age, for they are also possibly at high risk for PCOS is one, and
Mm.
girls who have early signs of puberty, premature, adrenarche, premature axillary hair, pubic hair, that kind of early features of puberty can also be one feature. But then really what happens next comes this adolescent girl with PCOS. Then comes the young woman with PCOS. And then comes the difficulty with the pregnancy. Then comes pregnancy losses are increased in women with PCOS. And if they do succeed, they may get gestational diabetes. They are also at increased risk for high blood pressure during pregnancy, gestational high blood pressure. And if they give birth to a baby, because when you have high blood pressure and things like that, you can have a low birth weight baby and the cycle repeats itself, right? And then as they go into adulthood, again, all these things about excess facial hair, and to add to what Sheila was saying, a lot of women with PCOS have eating disorders. Bulimia and binge eating, night eating, they may have those issues. They also have a lot of mental health issues, anxiety and depression and, body shaming, body image issues. So those things can predominate as they get a little older. Then when they get to menopause, as Anjali was saying, see, menopause by itself causes body composition changes and weight goes up, and people can have what we call metabolic changes. And that's one important aspect of PCOS that as an endocrinologist, I'm most worried about, that they are at risk for diabetes and heart disease. So all of that starts, to pick up pace around that time, because as they have problems. And as they get older, heart disease. So, and then certain cancers, especially cancer of the uterus, because of the see, women can happy when they don't get menstrual cycles for months on at a time. But that's really, they should not be thinking of it that way, because it increases their risk for cancer of the uterus. So PCOS has got an effect on a woman's life throughout her lifespan, from birth till old age.